Now we're going to discuss the osteochondrodysplasia, and the big one is going to be achondroplasia. Okay? This is also an autosomal dominant disease, but many are new mutations, so that you may not have a family history, and this patient presents with achondroplasia, so that's a new mutation. However, it is autosomal dominant. That is the mode of inheritance. What that does tell you is that you can have two achondroplastic dwarfs, which is what they're called, and they can have a normal-sized child because of the genetics involved. The major findings, absolutely, you're going to find short stature. We'll show you pictures in a second. They tend to have a rather large head, and they can have a small foramen magnum, which can lead to hydrocephalus and can cause cord compression. They also tend to have a lumbar lordosis, and you'll see that in the pictures. The patients tend to have a tendency towards being overweight, and because of the way the head and the face are developed, they can have a eustachian tube that is small. Here is a patient with achondroplasia, and you can see the somewhat large head and a prominent occiput, and actually also a prominent what they call frontal bossing. They are at risk for the hydrocephalus because of the narrowing of the foramen magnum. And you can see here the lumbar lordosis as it comes to the sacrum, and it kind of makes them pooch their stomachs out a bit. Look at the shortened extremity lengths. The trunk is not as small in relation with the extremities.